Plus, how to overcome chronic pain. Dr. Tom Walters is here with simple exercises to teach people how to self-manage their own pains and injuries.
KTLA 5 News, LA's very own.
All right. According to the CDC, 50 million adults across the U.S. struggle with chronic pain. Welcome over here, Mark. Come on in. We'll just all scoot over. Whether you have pain or sustained an injury, our next guest says with the right education, exercise strategies, and mindsets, you can figure out what's wrong and take the steps toward healing.
That sounds good. He's written a book. It's called Rehab Science, How to Overcome Pain and Heal from Injury. Please welcome board-certified orthopedic physical therapist and strength and conditioning specialist, Dr. Tom Walters. Good morning, doctor.
Thanks for having me, guys. Thank you.
All right. Let's get to it. The truth is, we all eventually experience pain, and some of us have the tendency, hey, let's go to the doctor and see what he can do. But we should be doing more exercise. And you've written the book, How to Teach People How to Self-Manage Their Own Pains and Injuries.
Yeah, it's so true. I mean, if you look at the research nowadays, we see in most conditions in the musculoskeletal system in the physical body, which we as physical therapists treat, most of the time the recommendation now is try to avoid surgery. Most things you can manage conservatively with physical therapy, and the book is really designed, it covers the 50 most common conditions, has pictures of me doing the exercises. It's really meant to kind of empower people to figure out what to do for these different conditions.
This really speaks to me because I injured my back last year, and I've been going to physical therapy to try to avoid surgery, and it has really helped and had an impact. You're going to go over 5 of the most common types of pain, demonstrate some of the exercises to help alleviate that type of pain. And this is one thing that I have suffered from, sciatica.
Yeah, sciatica, such a big one. That's why it's first. So sciatica, your sciatic nerve starts in your low back. Your lumbar spine has 5 nerve roots. They go down the buttock area. I'm going to touch Kirsten's butt. Go down the buttock area, down the back of the leg, into the calf and foot. So people feel that radiating pain. So Kirsten's going to do what's called a sciatic nerve mobilization. We call this nerve flossing in the PT world, and a lot of people don't know about it, but it has more and more research for all different types of nerve pain in the arms and legs. And basically what's happening is that she's alternating between plantar flexing and dorsiflexing her foot and flexing and extending her neck.
At the same time.
Yes.
In synchronicity.
Exactly.
Okay.
So what happens, it's like pulling floss between your teeth. When she moves one direction, it pulls the nerve towards her foot. The other way, it pulls it towards her neck. And so it's like imagining pulling that floss. That's why they call it nerve flossing.
Do I do this while I'm having sciatic pain? Or?
Yep. This is often, you have to be careful with it because it does flare some people up. So you have to be really careful finding the right level. You know, most people can't go this high with their leg. Right. So she doesn't have symptoms right now. So you're going right to that point and you're just moving, and you just kind of do it periodically throughout the day. And you do have to be careful with nerves because if you do too much, they can kind of wind up.
And just that one leg that the sciatica pain is shooting down?
Usually just do it on that one side. I usually try to encourage people to do things on both sides, especially when it comes to strength work. But yeah, mobility stuff like this too, it's often good to do on both sides.
Okay, we got next is a form of joint pain. I'm going to let you. The word is a little long.
Yeah, so the next one is patellofemoral pain, which basically just means joint pain behind your kneecap. It's one of the most common types of knee joint pain we see in physical therapy. It would be right behind, it's on the front of the knee, behind the kneecap. People will feel a sharp pain with squatting, lunging, a lot of times going up and down stairs. And so with the research on this, you really want to strengthen your glutes. You want to strengthen your quads too, but we'll start with glutes. And this is called a standing banded fire hydrant. So Kirsten's going to put this loop band around her thighs, and she's going to get into kind of a hip hinge position, almost like a mini squat. And then her leg goes back like a dog peeing on a fire hydrant. That's why it's called that. So it strengthens your hip abductors and your external rotator. It's a major glute burn. It'll get the other leg like crazy too. So this is a great one to do on both sides. And if you strengthen those muscles, it helps to control your femur and it takes stress off your kneecap.
Excellent. Rotator cuff.
Rotator cuff. So with the rotator cuff, there's 4 muscles. Most people tear their supraspinatus, which runs across the top and comes out. It'll usually hurt here and kind of down the side of the arm. So we're going to strengthen the shoulder external rotators. This is one of the most important rotator cuff exercises to do. A lot of times people have seen this with a band, standing with a band. But I actually really like this dumbbell variation. It's the same thing. So she's going to go kind of from her stomach up through full external rotation range of motion. And it strengthens 2 muscles right here on the back of the shoulder, infraspinatus and teres minor. So
you put the towel in there.
The towel is there. It kind of helps keep the shoulder in neutral. Sometimes if the arm gets all the way to the side, people have more rotator cuff pain. It's kind of like people will also get pain with this if they sleep on that side. Same idea. It kind of compresses the arm. So that helps protect it.
Okay, next one, Achilles.
Achilles, right? Everybody's a lot of runners around here and Achilles problems. So Achilles, most people know about the standard calf raise, right? Just like a regular calf raise, which is really important to do. But I'm going to show one for soleus. Soleus has received more research recently. It's the deeper calf muscle. But to do this one, you have to do a calf raise with your knee bent. So essentially, you'd hold onto a wall or a partner. Kirsten's going to bend her knee kind of down like that, and then do calf raises. So you're keeping the knee at a flexed angle, and then you do calf raises. So you still want to do the knee straight variation, but this helps get that deeper soleus muscle, and more Achilles issues, especially in runners, have been tied to this muscle.
That looks like a cramp about to happen.
Yeah, that's right, exactly, totally.
And quickly, we're out of time, but carpal tunnel syndrome.
Carpal tunnel, you're going to do a nerve mobilization. So Kirsten's going to be up here working her median nerve. It's like the sciatica one, but it's for a nerve that goes from the neck down the carpal tunnel. So she's moving her wrist and elbow and her neck and doing the same kind of nerve flossing for the median nerve.
Excellent. All right, once again, Dr. Walters' new book is called Rehab Science, How to Overcome Pain and Heal from Injury. For more information, you can go to rehabscience.com or follow Dr. Walters on Instagram. Thanks for helping us out. Both of us have experienced pain. And
we all do. We all have
stuff.
Certain age.
Exactly. It's all
Thank you for doing all the exercises.
Short break.